top drug recovery organization is stretched thin because of fentanyl, and that's creating devastating consequences.
Fox 12 investigates how Portland's Central City Concern is handling a rise in drug overdoses in its facilities. Some of them are supposed to be drug and alcohol free.
Adrian Thomas is joining us now in studio with this story. Good morning.
Kim, Shauna, good morning. Central City Concern receives millions of dollars in local and federal funding each year to help people with addiction recovery, transitioning out of prison or homelessness, among many other programs. But with an abundance of resources on paper, the nonprofit still acknowledges the drug crisis on Portland streets has posed challenges, and an even greater toll is taken on the residents of its facilities. Last November, Patrick Bouchard finished serving a 2.5-year prison sentence and was referred into a work program at Central City Concern's Estate Hotel in downtown Portland. Bouchard has not struggled with substance abuse, but was in a program designed for those transitioning back to society from incarceration. Bouchard tells us in addition to his work program, the Estate Hotel housed residents who were in some of Central City Concern's programs for substance abuse recovery. Bouchard was eager to get his life back on a positive and productive path, but he quickly noticed problems.
I would say it was worse than my prison stay. Like the cleanliness in the place. I had to step on a puddle of urine almost every day for the first 3 months. Walking into the building, there were random homeless people running around trying to break into apartments.
Bouchard shared his lease agreement at the Estate Hotel with us, and this document clearly shows the community is meant to not have any drugs or alcohol on the premises. Bouchard says this was far from reality, frequently seeing people handling and using fentanyl, and it took a toll on him.
Literally, I was sleep deprived for quite a long time because of all the drug use and people running around in there. I was supposed to be in a work program that, I was able to be comfortable enough to go to work and start my life over.
The explosion of fentanyl in the Portland metro area has, not surprisingly, seeped its way into Central City Concern's operations. According to 911 dispatch data from the city of Portland, there was a steady rise in overdose calls to 6 Central City Concern residential facilities in and around downtown Portland. From 2021 through 2023, the total number of calls across the 6 facilities we examined more than doubled. Dr. Andy Mendenhall is the CEO of Central City Concern and has a background as an addiction treatment doctor. He acknowledges the challenges his organization has faced in recent years because of the potency, low cost, and easy access to fentanyl, which strains resources.
Unfortunately, over the last couple of years, we've been not just regionally, but nationally in the midst of a fentanyl epidemic, whereby even the folks that seek treatment on a regular basis sometimes don't have access to the services that they need.
But even for some who are in Central City Concern's transitional recovery housing programs, a program that Mendenhall says comes after a resident has completed detox treatment, the risk remains high. Our team has obtained multiple police reports that detail stories of Central City Concern residents being found dead in their apartments after an apparent overdose. First responder summaries also suggest it was a considerable amount of time before they were even found by staff. One Portland police officer narrative from a death investigation at a Central City Concern building this past summer says they were called to do a welfare check due to a, quote, foul odor coming from the apartment, and that a Central City Concern employee on scene said the man who had died had, quote, not used his key fob to enter the building in 11 days. When the responding officer entered the apartment, he said he, quote, found a deceased male lying flat on his back on the bed, and his status of decay made it impossible to identify him. Another police report from earlier this year suggests one man who died of a suspected overdose was not discovered in his apartment for nearly a month. In this instance, a Portland police officer was called to this Central City Concern building after a staff member found a resident dead while doing unit inspections. The police report dated February 28th says the man's last sign-in and sign-out was on January 26th. The report also says that the man, quote, had already started to decompose. The medical examiner also found a burnt piece of foil with residue likely containing fentanyl. Given some of these recent incidents, we asked Dr. Mendenhall about how Central City Concern is responding.
What would you say to those family members who have gone through that and maybe felt like their loved one was just forgotten?
Well, we certainly see every outcome that's unfavorable as a tragedy, and we are always seeking to improve our programming and to learn where are there gaps that could have potentially been closed. We're always trying to evolve as a system of care and as a system of services.
Patrick Bouchard now rents his own home in Portland after living at Central City Concern's Estate Hotel for 10 months. While he's grateful to have his life back on a good path, he hopes improvements can be made to the program he was a part of.
What would you like to say to leadership at Central City Concern?
Care about every single person who comes through that door. Care about how their families would feel about how you treat those people on a daily basis.
And we're told Central City Concern's budget for this fiscal year is around $180 million, much of that funding coming from the federal government through Medicare and Medicaid payments and the U.S. Department of Housing and Urban Development.
Adrian, it is shocking to hear that amount of money and the problems and the tragic deaths that have occurred. Where's the accountability? What are the protocols for checking people for drugs before they come in? And why isn't this happening? How's this being allowed to happen?
So we asked Dr. Mendenhall a little bit about that, and what he said is that rules and regulations really depend on the program. Those transitional recovery housing programs where someone's coming out of detox and they're in that kind of transitional stage, they live in their own apartment, essentially. It's like an apartment building. And in some of those intense transitional programs, Dr. Mendenhall said the expectation of contact with staff is about once a week. But clearly there are some things slipping through the cracks because there are people dying of drug overdoses and they're not being found for days, sometimes weeks.
Wow. My goodness. And you talked about a $180 million budget, a lot of it coming from the federal government, which is tax dollars as well. But how much local tax money is going towards this?
So a big pot of local tax dollars is the Metro Supportive Housing Services dollars that have, flowed into the community in recent years. And according to Multnomah County records, since 2021, the Metro Supportive Housing Services bond measure tax, about $14.3 million of just that tax alone has gone to Central City Concern, a little less than $10 million of which went to the nonprofit within this past fiscal year.
Wow. We both said the same thing. I mean, there's so much more to talk about. We're limited on time, but it is disturbing.
Yeah, absolutely. Lots of resources on paper, but clearly a lot of issues that they're having to deal with.
Wow.
Okay.
All right.
Adrian, thank you.
Thank you.